Welcome to the third and final session of the Knox County Health Department's three-part series on diabetes management. We have learned a lot so far in this three-part series. In our last session, we talked about eating well with diabetes, we learned about healthy eating and carb counting, and we even did a little bit of practice. In this session, we'll be talking about everyday diabetes management tips. We'll talk about high and low blood sugars, travel tips and eating out, caring for your feet, managing diabetes while sick, getting active, and then we'll close it with a discussion about saving money on diabetes care. As a reminder, we like to think about diabetes management in terms of the three-legged stool approach. We have healthy eating, exercise, and medications. Each one of these components is just as important as the other in order to make this three-legged stool work. First, let's take a look at tackling blood sugar highs and lows. Treating low blood sugar is very important and should be taken very seriously. As a reminder, another word for low blood sugar is hypoglycemia, and this is a blood sugar reading of anything 70 milligrams per deciliter or less. If left untreated, severely low blood sugar can lead to accidents, injuries, can lead to a coma, or even result in death. It can happen as a result of taking too much insulin, or going too long without eating, or exercising too much. Symptoms of low blood sugar can be mild at first, but worsen quickly if they're not treated. You want to make sure to check your blood sugar right away if you have any symptoms of low blood sugar. It's never a good idea to try to rely solely on the symptoms to tell you what your blood sugar is doing, whether that be high or low. This screen shows many of the common symptoms for low blood sugar. These can vary widely from one person to another, so pay attention to what your main symptoms are when you start to notice your blood sugar is too low. This can include shakiness, sweating, chills, clamminess, but it can also include headaches, weakness, fatigue, or even having nightmares. So it differs from one person to another. If you experience low blood sugars frequently, it may be worth talking to your doctor about your medication and treatment plan to see if there's something that you can do to prevent getting low blood sugars. The Rule of 15 is a tool that you can use to help correct low blood sugars. You can use this as a simple cycle of steps that you can follow until your blood sugar reading is back in a normal and healthy range. So step 1, if your blood sugar is less than 70 milligrams per deciliter, you should take 15 grams of carbs from what we call a quick fix food. Step 2 is to wait 15 minutes. You probably want to sit back and relax while you wait for the quick fix food to take effect. Step 3 is to check your blood sugar level again. And step 4, you want to repeat all of this cycle if your blood sugar is still less than 70 milligrams per deciliter. Here are some examples of quick fix foods. This can be glucose tablets, a cup of milk, a half a cup of juice or soda, but make sure it's not diet soda because diet soda won't cause your blood sugar to come back up. Call your healthcare provider if you don't feel better or if your blood sugar stays under 70 milligrams per deciliter after repeating these steps several times. Don't hesitate to call 911 and never try to give food or drinks to an unconscious person. If someone is unconscious and glucagon is not available or someone doesn't know how to use it, it's a good idea to call 911. On the other hand, treating high blood sugar is also important. High blood sugar or hyperglycemia can happen when you eat more than you planned or exercise less than you planned. It can also be the result of stress from an illness or from family or work conflict. If you have high blood sugar first thing in the morning, you may have experienced what we call the dawn phenomenon. And this is just a normal surge of hormones that your body naturally releases around 5 o'clock in the morning in order to start the process for waking you up. This might be an explanation for why you have high blood sugar first thing in the morning, even before you've had anything to eat or drink. Symptoms of high blood sugar include having a high blood sugar reading of 180 milligrams per deciliter or more, feeling very tired, having extreme thirst, having to go to the bathroom more often, and blurry vision. The best strategy for treating high blood sugar is to prevent it from happening in the first place. Always take diabetes medications as instructed, follow a diabetes meal plan, and talk to your doctor about adjusting medication if you see that your blood sugar is regularly high. For mildly high blood sugar levels, Going on a walk after a meal can help bring your blood sugar back down. However, if your blood sugar is very high, somewhere 240 or higher, you should probably not consider exercising at that point. If your blood sugar is above 240 milligrams per deciliter, check your urine for ketones. Ketone strips, as seen in the picture, can be found at a pharmacy. Ask a pharmacist how to use them. If you do have ketones, it's important that you do not exercise at that time. If you fail to treat a high blood sugar level, ketones can build up to dangerously high levels in the body, and a condition called ketoacidosis or coma from diabetes can occur. Ketoacidosis happens when your body doesn't have enough insulin. While this is less common in type 2 diabetes, it is still possible. Without enough insulin for a long period of time, your body does produce ketones, which are what causes a diabetic coma.